K4Health Offline Tools, a knowledge lifeline for Peace Corps volunteers. Peace Corps volunteers undergo rigorous training on their new language, culture, and jobs to prepare for life in their new country. Then they are sworn in as volunteers, sent to their sites, and told to make an impact. Luckily, Peace Corps provides volunteers in several countries with offline K4Health resources. We at K4Health were curious about how volunteers were using these materials. We asked Catherine Lee, a graduate student at the Johns Hopkins Bloomberg School of Public Health. Catherine was a Peace Corps volunteer in Guatemala from 2011 to 2013. Her training in the spring of 2011 was her first real exposure to health education and her first real need for health education materials. When the volunteers got a K4Health USB drive containing manuals and links to additional materials, Catherine was excited to see Guatemalan materials in Spanish, such as a Guatemalan toolkit on the standard days method of contraception. Catherine used the K4Health materials to develop a dynamic curriculum to equip local health promoters to deliver short health lessons on topics such as prevention of communicable diseases and malnutrition, improved water and sanitation, and family planning to their communities. The K4Health resources helped Catherine decide what topics to focus on and understand common practices and terminology in Guatemala. She told us, "That was really cool, because as much as we had learned in the few months after training, there was still just so much to learn about what was actually done, what was culturally acceptable in Guatemala, and what things were called. Coming from zero to being able to train health promoters on contraceptive methods, it was a good training." Some of the people Catherine trained had never been in a classroom and could not read or write. Others were training to be teachers. The K4Health resources equipped her to adapt her lessons as needed and answer participants' questions effectively. During her time in Guatemala, Catherine trained 7 women's groups and 60 indigenous health promoters. She was among the first to use the USB drives, but as the word of their value spread, more and more volunteers relied on the materials. With more than 120 Peace Corps volunteers in Guatemala, K4Health's offline tools have made a lasting impact by helping volunteers effectively train health promoters to spread health knowledge in their communities. At K4Health, we believe that knowledge saves lives. We are proud to provide offline tools as a lifeline to those who need health information but lack reliable internet access. Contact us to learn more about K4Health's offline tools.